like the others. So, I think just as a background, our colleague, Dr. Scott Kamalata, unfortunately he's teaching right now, so he won't be here, but he reached out to Dr. Michael Shin, a coffee with him, and wanted to kind of share what we do and then kind of learn more about what he does. And we invited him to give a seminar, and we're very fortunate that he agreed, and he's here today. And I really love his the first sentence of his abstract. So the title of the talk today is Mapping Health, Considerations from Geovisualization to Spatial Analysis. And his first sentence goes, health happens. Instead of shit happens. Health happens, right?
Well, it could be one and the same, depending.
But what's more is that health happens somewhere. And I think today we're going to spend the next 60 minutes to learn about his work. And I encourage all of us to, hopefully we'll have some time for question and answer. And I'm hopeful that this is the beginning of the ongoing dialogue that we're going to have. So, Dr. Michael Shin from Department of Geography.
Thank you. Thank you all for attending today. I'm from the absolute north side of campus, and you're about as far away as possible for me as you can get. I'm starting this talk as most, I think, social scientists would to a health audience, the classic John Snow color map, and modernized it, overlaying it on some Google imagery and doing some kernel density estimation. It's the same data, but just visualized differently. And I think when we think about health geographics or medical geography today, a lot of times most people just associate maps and epidemiology, the intersection of those two fields. And what I want to do today is kind of extend and try to broaden your thinking of geography, what geography is, and how it matters with respect to health. I understand that you all have a very particular focus, but in my conversation with Scott last month, you described several of the projects that were ongoing here in the center, and it struck me that a lot of the things that I'm doing and a lot of the methods that I use could be applied to some of the questions and projects that you all are interested in. So that's what I want to do today. It's going to give you a high-level inventory. I'll tell you briefly about.
Guy in this.
Yeah. When people think that I'm a professor of geography, they tend to think of rocks and ice and snow and things like that. So I have to have the picture that says as much. But I am considered a political, economic, social, urban, and to a certain degree health geographer. So I study the geographic patterns and processes on the social science side more than on the physical science side. And as somebody mentioned, they met a Michael Shin in a previous time. I'm the former sushi chef. So that's how you can kind of keep me separated from everybody else. My regional focus is on Italy. So anything with respect to Italian politics, Italian economics, that is where I do most of my research, which is not such a bad place to go. I have colleagues come back sick and everything, and I'm going to Tuscany. So small sacrifice that I have to make. I'm also the director of what is called Geospatial at UCLA, and you can look at the website gis.ucla.edu. And this is an initiative to expand and broaden the use, application, and education of geospatial tools, methods, and techniques across research as well as in education. So we offer, for example, in our department, a minor, we have a professional certificate, and we're establishing a master's degree in GIS as well. As I mentioned, I've been at UCLA almost 20 years now. I took a 2-year leave of absence. I did some consulting. That consulting was in the pharmaceutical industry, which, I was channeled into the pharmaceutical industry on the basis of my geospatial background. So my trajectory of my interests and the broad spread of my interests really stems from my expertise in geospatial methods, geospatial analysis, and geospatial data, of which 80% of all data is argued has a geographic component, zip code, address, state name, street name, that means we can map it, we can analyze it in a geographic way. Feel free to contact me at any time. I have a very easy email address to remember. So today what I want to do is to give you a high-level tour of my journey through the geospatial in 3 different vignettes. And the most important thing I want you to leave with is to think about geography differently. I think when people hear that I'm a professor of geography, haven't we discovered everything already? But in fact, I want to introduce a more dynamic and malleable conception of geography that I think could be really useful, not only to social science research, but also medical research as well as medical practice. And I'll do this through 3 vignettes of some projects that I've been working on and off throughout the years. The first, we'll look at geographies of Medicare, which is more or less a classic puzzle. Why do Medicare costs vary across the United States? But now we have big data, we have all this computing power that we can throw behind it, and it's still more confusing than ever. I'll present some research that I did previously with a colleague in public health, and we looked at obesity patterns in voting and trying to make that connection because it's one of those, some would argue, a spurious correlation, but it always gains traction around election time. And so what we did was we actually looked at it in a more formal sense, and that leads me to this field experiment that I've been struggling to advance, given some ethical concerns. And this is a good environment to present the research, and also seeing that Mark Zuckerberg is testifying in front of Congress as we speak. I can say better him than me, so I'll present that. But at any time, if you have any questions about anything, feel free to stop. This is an informal talk. Again, I'm going to try to keep it at a very high level.
Who do you work with in public health?
Jim McCarthy. He was, I think he's still in public health. I think he's in the cancer center. So at UCLA and across social science, across research, the doctor versus doctor divide still persists. And there's the medical doctors that do medicine, and then there's the academics that do research and teaching. And campus is divided between North Campus, South Campus, and medical campus. And I'd like to see a little bit more cross-fertilization. I've done, like I said, some work with some people in different areas, but there's certainly a lot of possibilities, and I think there are several blind spots that we all need to overcome. And a couple of these blind spots and opportunities concern moving beyond looking at maps purely for their patterns and variations, which are important. That can certainly stimulate questions in an exploratory sense, where we look at, all right, there's a lot of sameness or homogeneity in certain regions, but there's also differences between them. Okay, that's kind of the standard geographic approach. On a more methodological side, I'm very interested in reframing how scales and units of analysis are conceived, because as methodological experts, we often require to be very precise in our definition of data. So we want our data at the county level, individual level, state level, and classical statistical theory really requires that these units be independent from one another, when in fact that's definitely not the case, right? These units are nested within each other, and there are relationships among them that we need to try to model or understand better in a substantive sense. Yes, we can model them in a quantitative sense, but substantively, theoretically, practically, what does that mean to a patient or a voter or somebody else? So I'm interested in these relational networks, not only across scales, but between them as well. And this brings us to this notion of context in terms of how we conceptualize and operationalize various concepts that we use. So, for example, if we're interested in the retired as a group, does being retired in Arizona mean something different from being retired in Florida to being retired in France? And it certainly does. And understanding that context, trying to model it, trying to capture it in a quantitative sense, There are many ways to do it. We could do it in an additive way. However, that is arguably quite insufficient. And then in this big data environment, there's a lot of opportunity when we look at big issues such as climate change and little or even micro and finer scales to understand what's going on the health side. So the first project that I want to describe to you kind of draws from the classic perspective of let's map something, let's look at the pattern, is why do Medicare costs vary? There are several explanations and understandings for why they do so. Wages, real estate, just the costs vary from place to place, right? That's kind of the input is one of the driving factors. There are variations on the demand side. So the beneficiaries vary. The populations of different states, different cities, different hospital regions, they all vary. And so we're capturing that as well. And then clearly there are differences in service availability and use. Here in Los Angeles, Southern California, we have some huge medical centers, teaching hospitals that really focus on some of the more challenging cases. Whereas, if you're stuck in rural America, your options are quite limited. So that will certainly affect these patterns. So you could say, certainly, yes, it is complicated. So if we look at the state-by-state variation in covered charges from 2011 of diabetes, you can see here, these are the average charges. This is, what is that, 2000 to... Yes, 120. And then you can see there's quite a bit of variation between the states as well as within them. Okay, so what I'm interested in
Is the data point a hospital?
A hospital, yes, these are the hospitals, correct. So across the literature, there's a lot of concern about the state-by-state variation, but within individual states, within cities, within Los Angeles, there's a significant amount of variation, which should be understood a little bit better. And now, in this era of big data, we certainly have the opportunity to do so. Similarly, with heart attack cover charges for survivors of heart attacks, the pattern is similar. You have some very expensive states. They're similar states, for example, California and Florida, obviously, because of the cost of living and things that we've identified, tend to be at the top, but there are also movement between the states in terms of the ranking. Okay. But it is interesting to note, for example, Massachusetts is always on the right side or the lower costs, and Florida, Nevada, California are on the higher end.
Did that change like in the last 15 years? When Massachusetts made those?
I'm working to munge the latest data to kind of try to capture those effects of Romney care and things like that in terms of the long-term runway. But I'm not sure. With 2015, I think was the latest data that are available. We'll see that. So. But again, for example, I can't read that if that's Pennsylvania, but you can see the outliers are worthy of further investigation as well. So in a geographic sense, we're looking at things state by state as well as within them.
So Michael, those outliers, are they representing one case or is it group?
That's an individual case.
Individual?
Yeah.
Individual hospital.
Individual hospital, yep.
Gotcha.
Can you just tell us, what are the first two over there? I can't read it. Is it
New Jersey
and
Nevada, I believe. And Nevada is always up there. Yeah.
California is always number 3 or 4.
But one other thing to bear in mind is for Nevada, it's probably a handful of hospitals with a quite large variation. Whereas California, you have hundreds of hospitals, right? So again, there's the nuance that often is missing in the map, despite the fact that if we do map, for example, diabetes spending in 2015, certain patterns certainly emerge. And for example, the fact that you can go to healthcare.gov and map data That's a huge advance over the last 5 years. So in terms of increasing awareness of the geography of health and the data opportunities, now is a great time because making this map 10 years ago would have taken a lot more effort. And then the same thing here for the heart attack data. You can compare the two. Right? So spending not only varies state by state, it varies by the DRG codes, it varies within the state. So as we dig deeper into the data, it gets more complicated, but that also presents an opportunity for us to understand even further what's going on. And this also brings to mind my bigger question about scale. Right? We have these hospital regions, and they're significant to the government, but are they significant to patients? Are they significant to the general public? What is the significance of the unit of analysis for a researcher? In a methodological sense, we might say, oh, I need county level data. What do I do with missing data? We have all these methodological questions, but substantively, does it matter in terms of an outcome? Right? I think we need to really start thinking carefully about the units and how they are related to each other. Again, from an accounting point of view, this makes sense to the government. For a hospital administrator that's dealing with one department, it probably makes absolutely no sense. And how might that affect the health outcome? Or an interpretation or charge or whatever is something I think that needs to be examined a little bit more. Which brings me to rethinking the where behind the map. Everybody can see that this is Italy, so I just basically created a network of the capital cities of each province. There are about 110 provinces of Italy, and I just connected them to their nearest neighbors. Okay? So rather than mapping things in terms of areas, this is a map of the network of relations between individual provincial capitals. And you can imagine if we did this for hospitals or teaching hospitals or clinics, all those geographies would be different, and all those relationships we can model in different ways. What's the relationship between a teaching hospital and a local clinic? What's the relationship between clinics, right? In terms of not only financial relations, but patient relations, doctor relations, scheduling, all these things we can think about in different terms to map and come up with various hierarchies and topologies or connections, which I think can give us further insight into the geography of health. One thing that I'm particularly interested in with respect to the Medicare data are how prices move, okay, locally. Like, do the prices for diabetes move locally in terms of the 5 nearest hospitals to the UCLA Medical Center? How do they move over time? Or if we look at only teaching hospitals and the nearest 10 medical centers, how do prices move and change? Because market integration suggests that all prices should more or less stabilize and become more or less equalized over time. But the Medicare data show that that's not the case. Medicare is not a pure market, but there's something to be learned from how these prices change. So again, that's something to be learned. And again, it's a question of rethinking our units of analysis, scales of analysis, moving beyond the idea of a unit as a static, fixed container, and then introducing a little bit more context to the discussion. So with respect to context, place, and health, statistical independence has really driven a lot of us to do certain things when we model outcomes or when we examine outcomes such as voting or health outcomes. But one thing to remember is that geography is not additive. You measure a particular variable, or you measure a particular outcome, for example, in a neighborhood. Sometimes we're going to add a neighborhood to this particular model, or a measure of a neighborhood. But arguably, the geography contextualizes the measurement itself. Like I said, being retired in Arizona being something different from being retired in Colorado versus being retired in Florida. Right? How can we actually capture that? And ultimately, this brings me to this notion of a place, which is not something that you put on a map, but it's actually the locus where policy, practice, process, and behavior are mediated. We as individuals mediate state policy, federal policy, local policy through our everyday actions, and that has an impact not only on the patterns we see on a map now, but on in the future as well. So how can we capture that and understand that better, arguably, is an important goal for us at the intersection of social science and health. So in this sense, there's a lot of interest in the neighborhood effects, but I would argue, you can't really remove the neighborhood or identify a particular neighborhood and remove it from Los Angeles and remove it from California and remove it from they're all connected in such a way that we really need to be mindful of these relationships. So, based on the relations around units of analysis, my methodological expertise is in geostatistics, and this is from a paper that I wrote with William McCarthy on the obesity and voting nexus, so to speak, and we looked at county level estimates for obesity and voting for Romney or Obama. And here, the colors denote the candidate that the county, the amount of vote that the county support was situated there, and the actual size of the county is scaled to the obesity prevalence rate. Okay? And we actually modeled and found that there is a very small statistical relationship between level of support for the Republican candidate and higher levels of obesity. Whether or not that association is substantive is matter of discussion and debate. But I think what is most important is just to think that voting matters because the policies that get enacted at different levels affect our everyday lives. Okay? And this might be a spurious correlation at one level, but for example, when we have such low voter turnout in local elections, for example, in school boards, and a school board election in Texas, I believe, was won by fewer than 20 votes, and the school board decides what textbooks to use, that has a really big impact on the futures of a lot of future generations. And so we have to look at the downstream consequences of a lot of these things that, from a data point, when you get a new data set, you want to get your hands on it and start munging it. But at the same time, making these connections is quite important that I think from a geographic perspective, there's more to it than simply the map. So back to the final example that I want to talk about is the field experiment that I conducted here in Los Angeles. And again, in the 2013 mayoral election, there was only 23% turnout. This is an artifact of a variety of factors in Los Angeles. The mayor is relatively weak. We have a very strong city council. And it's Los Angeles, right? They're considering paying people to vote in Los Angeles, if that tells you anything. But what I want to do to conclude or to kind of walk you through is this experiment that I did to try to stimulate civic engagement. And in the literature, there is certainly more discussion about the relationship between civic engagement and health. Like the more civically engaged individuals are, the healthier they are because they participate in the community. So this has something to do, again, with some of the more social dimensions of health. But here we have, this is the geography of turnout. You can see turnout is much higher in wealthier areas. So this is Santa Monica, this is South Los Angeles, Santa Monica Mountains, here's the valley. And this map reveals clusters. So these are statistically significant clusters of high and low voter turnout. So if we go here, this cluster is below average turnout, and this cluster you have above average voter turnout. And knowing this, you can do all kinds of fun things. So in social science, there's recently been a renewed interest in field experiments. And to a certain degree, I think there's a dovetailing with all the available data, for example, with Facebook, Google, social media, that are kind of ballooning and intermixing for good or for bad. I'm sure you guys know all the research design stuff. I put this up there for my social science colleagues. I will say that this research was approved by the IRB before I did it. This was way back in 2014. It's not published. I should probably ask you guys to sign a waiver that you guys won't turn me in or anything. But in any case, this particular project got me thinking after I talked to Scott about the relationship between civic engagement, health, ethics, and how we can actually create interventions to stimulate civic engagement, which might have a downstream effect of improving health, and if we can promote civic engagement. So what I wanted to do was to try to stimulate voter turnout. And to do so, I got a hold of the Los Angeles County voter file, which had 4.8 million records. And back in 2014, this was a big data question. It's not so big anymore. But in any case, this is a map of all the individual voters and how they are registered. Red is Democrat, blue is that right?
No.
No, it's the other way. I studied Italy. It's the other way in Italy. Yeah. Yeah. But in any case, and then the white dots are independents. But this is a zoomed in on the LA basin, and if you zoom in on Hollywood, you can see the individual patterns. So, yeah, I'm actually mapped. If you're a registered voter, you're mapped on here too. These data are public, freely available, and it's updated after every election. So in 2012, we can tell whether or not you voted or whether or not a registered voter voted. Okay, and red means they didn't vote, white means they did. So a lot of people aren't voting. So from that 4.8 million registered number, this was for the 2014 midterm elections. 3.4 million had phone numbers. Okay. Of those 3.4 million, 2.5 million were unique numbers. So if you or your partner registered in the same household, have the same number, we combined those records. Some of you are on the do not call list. We respected that. So we took you out. And that left us with 1.5 million voters who were registered for the 2014 election that were okay to call, but who did not participate in mail-in elections. Like you can register to be a mail-in ballot only. Took that out. And then I bought a cell phone registry to determine whether or not those numbers are cell phones. And that was, I think, for a year's access, $500. Okay.
That's all?
Yeah.
Is it still like that?
Well, we'll see after today, right? So I have 500,000 cell phone records of registered voters. Okay. And now I'm a benevolent, good citizen, and I'm trying to stimulate turnout. So what I wanted to do was see whether or not text messaging would be an effective way to mobilize voters. So I sent 5,000 5,000 of the first text message and 5,000 of the second text message. The first one, I just told the registered voter's first name and said, don't forget to vote today. And the second one, I told their first name, don't forget to vote today. Click this link to see your polling place. And during elections, Google offers an API, which if you type in your address, it'll show you your polling place. So what I did, well, not me, a really smart grad student, pulled the addresses from the registered vote list and plugged it into the API, so when somebody clicked on that, their polling place would come up. Okay. And we did this with 2 disposable phones for a total of $150. So again, this is, I think you can slowly see some of the implications of this. So, the morning of the election, we were in my office, and we were sending out 10,000 texts. Okay, we had a treatment group and test group. One of the things that we did not expect was that people were going to reply back. But I think this is actually, upon reflection, perhaps the most important finding, especially for central for you guys. Yes. Yes, this is. So the numbers, we bought, SIM cards, and they just were random numbers. And I did call the FCC, and we were operating in a gray area at the time. And now, if this experiment were to be done today, it would be illegal. Okay? Because A, you as a voter have to opt in, and B, the actual source of the message has to be identifiable. So this is where I'm having a little problem writing this paper up. You're not going to see it.
You know what? There's a paper, they didn't use text messaging, but the one that influenced 61 million voters in science, I presume you've seen it.
Yes.
Yeah. Because those guys got in science, you should be able to publish.
Yeah, exactly. I should. But in any case, this is one of the interesting things about these replies are that they're almost instantaneous. Okay. Yes, I'm trying to stimulate a response to vote maybe later in the day, but I actually got a response within a minute of sending that text to these people. These are the disappointing results. It doesn't matter. Text messaging doesn't matter for voting. Okay? Because what I did was I got the voter file in January after the election, and then I could cross-reference to see whether or not a person voted. But there's really no effect. But again, like I said, I think for this center, integrating mobile technology, dovetailing different data sets together is a real opportunity if you can get your participants to opt in. So, just kind of to close, and then we can have a discussion about, if you want to talk about data methods or approaches. I wanted to reiterate the fact that geography is a dynamic framework to understand and analyze things. Yes, we tend to view geography as a static enterprise that just offers maps and we can see variation. But I think how we construct a map, not only on the screen but in our minds, in terms of the data sense, how do we organize data, how do we nest data is an important thing to consider. There are certainly opportunities given the plethora of geospatial tools available freely. Again, some of the things that you can link together now at zero cost. It's quite scary. But at the same time, you need to be very aware of the pitfalls, ethical and otherwise, as we embark in this new era. Because what I found, even talking with the FCC and the Federal Election Commission, is that what I was asking them, they did not know how to answer. Because it had, maybe Facebook was doing it or Cambridge Analytica was doing it then, but they did not have a regulatory framework to address some of these things. And I imagine with healthcare data, it's the same thing. I do know, for example, Google, Facebook, they're approaching medical centers to enter into agreements to obtain all these medical records data, right? And it's a boon for medical.
Are they succeeding?
Well, we're talking a lot of money, and for example, if you look at the UC at large, it could be an attractive proposition. That said, there's a lot of unknowns and there's no regulatory framework, right? So that's the pitfalls behind this kind of advancement of technology, the opportunity, but again, who's going to actually take a moment to think about some of the broader social implications, because we don't know what they are yet. So, and with that, I leave you. But if you have any questions or you want to see any of those maps, I'd be happy to talk about them more.
So, yeah, we've got some time to have a discussion with Michael, so open it up to questions and thoughts.
So what about, where do we get this list of geographic repositories? Is there such a list? Is there such a...
No, it's everywhere in that most data can be mapped or associated with geography. Like if I have your phone number, I can match an address to it, things like that. So it's a matter of, I don't think there's a single place, but there are several places where you can cobble data together. But for a certain specific project, I think it really depends.
And on the Medicare data in particular, it would seem like health system, for like the cost for similar diagnoses within different insurance plans, like is CMS evaluating a lot of that stuff?
You know, I think the big push over the last 3 or 4 years for CMS has been just to get the data online, and they're less concerned about the insight, but they're more concerned about being or appearing to be transparent and say, not asking these questions, but saying, oh, here's the data, because over the last 3 years, it's unbelievable how much more data are available, but I wouldn't know, just trying to go through it all is quite a challenge.
And only one last question. Do you see any role for academics in this? Because our resources are so poor relative to, as you said, you went to McKinsey, or if you look at Google, what their capacity is to acquire these data and their capacity to analyze. What is the future of academics in this?
I was asking myself that when I was at McKinsey. You know, I had to make the decision: am I coming back or am I staying? And it's troubling. I find it quite troubling because of the power and the money and resources that they have. And to be completely honest, they operate in a completely different world in which the decisions that matter are being made regardless of the academic research and expertise. And I think more generally you're seeing that in this current spate of populism around the world, expertise is being shunned for what? For the profit. It's very problematic.
Given that you work in Italy, you see it different in the EU relative to the US.
In terms of privacy rights, the Europeans are more sensitive. In the United States, I think it's almost too late. Like, people were so eager to start sharing. I mean, oversharing. Oversharing like my sister. And it's amazing how, I'm not sure what's going to happen, but it's something that I think the context of privacy is quite different in Europe than it is in the United States, how we define privacy and what we protect. In, for example, our time. Americans are far more willing to work and burn the midnight oil. I'm making generalization here, but bear with me. If you have some European colleagues, it's a little, when it's wine and cheese time, it's wine and cheese time. Which I think, if you get the chance to visit, you're like, oh, this is the life, this is great. Whereas it's a different perspective, which I think infiltrates more broader social thinking and outcomes as well. So I'm not hopeful in the sense that the amount of money in industry, whether it's medicine, pharmaceutical, and everything else these days, it's quite overwhelming compared to the piecemeal funding that we get.
Do you see any way for us to leverage a role into those systems?
Well, with the overabundance of PhDs, I apologize. I have thought about that, and it's a matter, I think, of training the ethics into current PhDs, because they're not all going to get academic jobs, and when AstraZeneca or whoever comes knocking, those are the jobs that they will take, and they are quite lucrative. And I think it's one of those things. That's one of the mechanisms, because I don't think you can. I'm almost certain you cannot fall back on regulation. The regulation's too slow and it's too short-sighted. The people making the regulations don't see what's coming ahead.
Does Europe?
I wouldn't. Europe is more regulated already, so it's market penetration is much harder in Europe than it is in the United States. To introduce a new drug and it's much more difficult. I doubt that would happen in the United States, but it is a question. The future of academics, it's spotty at best, I would say. So.
I'd like to follow up on that. It seems like somehow the ownership of the information is a central concept in this realm, and I wonder, from your perspective, how do you see, if a person has a right to consent or has a right to have their information withdrawn, and so all of a sudden then there would be some leverage or it would change the dynamics. But I'm curious if you've thought about these issues in a lot of different contexts and wondering what your perspective is.
Well, it's certainly evolved in that I think at this stage, the ownership of our personal information, it's not about ownership anymore because we are the product, so to speak. And like I said, I know the UC has been approached by these big tech firms for the medical data. And I do know that there are labs in the UC where the research directors have agreed to enter into certain agreements to share certain data. But the UC doesn't have any regulations in place to prohibit or to oversee how these contracts or agreements are made. And again, it's a matter of, what was once harmless sharing of a photograph or a party or your street address to a friend now is becoming linked, right? It's not, your data is not necessarily that valuable, but it's how we can link it to other things to predict what you're going to do or what you're not going to do, or how healthy you will or won't be, or how much of a burden you're going to be on the insurance plan. This is where it gets really dicey, and this is where corporations already are. I mean, who doesn't want to save $1 on the $5 orange juice? So I'm going to sign up for my Ralph's card, and I'm going to scan it every week, and they know when I'm going to buy what I buy, and then they're going to link it to my health care data, and then my insurance company will say, well, you might be having a heart attack in the next 5 years, we're going to increase your premium. So these things that are going on in the background, we might view as increasing costs or whatever, but I'm not sure enough people know what's really going on.
So can you
but that's your JAMA article.
That is, yeah.
Yeah, so can you speak on that a little more, in terms of how consumers or how everyone is in terms of their privacy literacy? So in terms of, so you mentioned the civic engagement experiment you did, in terms of people actually have to opt in. So a lot of times I think we have no idea what's going on behind the scenes in terms of our data. A classic example recently, like Facebook, a lot of people have Facebook, and instead of each of us putting our political preference, I found out recently, a friend of mine told me that if you look at your profile based on the pages you visit and whatever you do, they have a category in terms of what. So I'm supposedly very liberal, but it's not something I put in. But they have that information in the background and they're using that. But I didn't know about it, and none of us.
No, absolutely not. But it's not only the information that you're giving up now.
Right.
So, for example, when Google goes around and updates their Street View so you can see what the storefront looks like, they can predict the proclivity politically of a neighborhood based on the cars that are parked on the street, right? And then once they know that, there's the license plate. We can identify it with you as an individual, and with motor voter, the Russians can say, oh, he's registered, and maybe, the linkages are what are really problematic in some sense. But in terms of privacy, there's certainly generational issues. Like when in one of my classes, I have a discussion on location privacy, and I ask students about, do you use Yelp, do you do check-ins, things like that. And I've noticed over the years, people, I have nothing to hide argument, which, okay, but all right, if you have nothing to hide, give me your passwords, right? So you do have something to hide. So again, it's an evolving space, and right now with Zuckerberg testifying in front of Congress, I think it will become a little bit more visible, although I'm not sure people will do anything. I'm a little pessimistic about whether or not it's going to matter. I think in certain respects, in certain industries, I know in pharma and for a lot of healthcare, we are way down that road because, with all the information that they have on prescriptions, who's using them, things like that, it's amazing, the data.
Colleagues working on data sets of 10, 20, 30 million people in the U.S. In the data set. All adverse reactions, all drugs, all diseases. Getting there between 3 and 10. And the ones I know about, I don't know exact sizes, but we're talking 3 to 10% of the kind of population in one data set.
Yeah, the issues of clinical trials, the government doesn't require really that many people. And then if you could get a healthcare system to give us your data, hey, you're doing a public service. But you don't mind if we use your data for other things too, right? You can't selectively say, I'm going to share this.
We pay people to take our data.
Yeah.
23andMe.
That's another crazy thing. I don't understand. I think generationally I'm from a different era, but like when that came out, I was like, why would you do that? I just can't see nothing good.
More traction.
Yeah. Oh, absolutely. I think people there's that pull to know where you're from. There really is.
But it's
something
going
about
beyond. That. It's like they're linking it to like health outcomes and all that, and I think
exactly.
Yeah. So
what happens if an insurance company buys 23andMe? Boom. So again, it's the geographic aspects are important, but I think there's a lot more that we need to be aware of. And this is hopefully will get you thinking about different things, and I'm happy to discuss more on any of these things.
Do other people have questions? So your network data from Italy, so do you link that with the health data? And at what level are you finding it useful to categorize and analyze networks?
Well, I should preface my work on Italy. I've always wanted to expand into different areas, but my primary work on Italy is on Italian politics. And I've made my career out of Italian politics because it's always changing. And it's like that scene out of The Godfather where it's like, every time I want to leave, they suck me back in. And it's not a bad place to get sucked into, but there's an election all the time, and I'm always asked to perform spatial analyses to analyze electoral outcomes and make electoral projections and things like that. But like I said, the connection with health, politics and health. You can't disentangle those, and I think that speaks to the separation of disciplines and professions now is becoming less rigid. So I think there's certainly opportunity to explore this connection. That's why Scott, I think, reached out to me.
Would you say that engineering, the engineering schools in the academic centers are going to be as obsolete as we are?
Except for computer science. Not obsolete. I wouldn't say obsolete. I'm not pessimistic. I'm pragmatic. I think there will be a place. There will always be a place for good, relevant academic research, and I think that's where, on North Campus, to a certain degree, there's a little bit of a detachment from bigger questions that I think are more important, that deserve more attention. And I think communicating these things to a broader public that they are important, such as climate change, link between climate change conflict and health. These things, water, these.
Could you tell us which companies to invest in water?
We should have a major or a program in water. It doesn't have to be engineering hydrology. I have a hydrologist that's an engineer in my department. I have no idea what he's talking about. But water is a big issue across the board in public health, whether it's mosquitoes or whether it's agriculture or farming, whether it's social policy in terms of building a new aqueducts from the north. There's just a lot to do, but I think we as academics often get so focused on the pinhead of our research that we miss the forest for the trees. And I think right now there's an opportunity to cross-fertilize and broaden our horizons a bit, although it's an institutional structural issue as well. For a place like UCLA, you get rewarded for being that singular focused expert.
I think you mentioned about the geographic unit and its context dependent scale. So do you have some general recommendation? I think you did by state, by county, by zip code. So usually what's the preference or recommendation on the appropriate unit?
I think you need to kind of do a sensitivity analysis on using different units, running models or a multi-level model as well. That's one way to kind of get at it. But I love numbers. I'm guilty of putting the data set before everything. But at the end of the day, I think if we think about how we conceptualize and operationalize the variables a little more critically, that goes a long way in being able to make some substantive statements about the limits of our insights as well as the possibility for what else exists. Because I think, what is it? With every equation in a paper, you lose 50% of your audience. So the numbers are pretty sad in that sense. So again, just being careful and thoughtful about what the data mean, and does it mean anything to the object of study? Does a county level measurement mean anything to an individual? Could an individual? We categorize neighborhoods as census blocks, but I can guarantee you go around, nobody knows where a census block begins and ends, or their census block. Okay? So I think the method often defines the geography, when in fact geography is more of a abstract conception that we should try to tease out a little bit more. But I'm sympathetic to the methodological needs of certain procedures.
In your department, do you have courses that would teach us how to make those cool pictures that are color-coded?
Oh yeah. Oh yeah. So actually, Scott and I talked about this. the Geospatial at UCLA initiative that I lead. It's geospatial at ucla.edu. We offer, so there's a professional certificate if you want to get a certificate that we run through Extension, but we can actually craft short courses and seminars if you'd like to do that as well. We've gotten a lot of interest from public health to run seminars. We haven't gotten around to it. But if there's a particular data set that you guys want to interrogate, or 3 data sets, we could build a course around that. Or if you guys are interested in just learning how to map CDC data, we could spend an afternoon, get lunch in here and just walk you guys through with open source software or the proprietary software that UCLA has access to. We can share those licenses with you as well. So we have a range of options. And we have
but maybe we could also provide, in particular, like you're planning to get the LA County, LA care data and the surveillance data, that there could be opportunities that we could bring the data sets that it might be useful to your students or your faculty that could allow them.
Sure. I mean, one of the fields of expertise that the GIS administrator we have is in web mapping. So if you wanted to create a web portal or web atlas, so to speak, for the data for your users or your center, we can do that as well. So there's a range, I think I said there's a range of opportunity.
Is it useful to you guys or busy work to you guys to collaborate with our kinds of issues?
Well, it depends.
Yeah.
It depends, yeah.
So do you have to comment on whether to use the ArcGIS compared to the open source ArcGIS software?
So I've been using ArcGIS for over 25 years. And I prefer using QGIS because it's faster and less cumbersome. And I do use R as well. But what I find funny is the R community is rebuilding ArcGIS in R, and that's somewhat cumbersome. And it's kind of rebuilding the wheel.
Free compared
QGIS is free as well. You should look at QGIS. Yeah. Yeah. Reinvent the wheel.
Yeah, so Michael, that's been really awesome. And
thanks for having me.
This is our beginning of our.
Yeah, anytime, drop me a line, and I'd be happy to talk with anybody.
All right.